It was hailed by Democrats as the greatest social legislation in America for more than 40 years, a law which would create an enduring legacy. It was officially called the Affordable Health Care Act. It became known as Obamacare.
Everybody should have some basic security when it comes to their health care.
When Barack Obama took office, almost 51 million Americans had no health insurance, so no way to pay for medical treatment. Mortality rates were going up and the cost of health care was rocketing. He wanted to do something, so he did.
We have now moved to the lowest uninsured rate in history of this country. And so tens of millions of people who used to have the fear that if they needed care and they couldn't pay for it, they now have coverage that didn't exist before.
From the start, the whole process was controversial. Even though it borrowed from conservative ideas and a similar scheme introduced in Massachusetts by a Republican governor, Republican lawmakers opposed it, challenged it, and fought it in the courts. Each time, they lost.
It's only getting worse.
But Donald Trump rode to victory in November with the promise that he would repeal and replace Obamacare. As people saw their premiums rise, this was a popular message.
In some areas, they're paying 60, 70, and 80% more than they were paying last year. It's over for Obamacare.
But Republicans are realizing that before they can repeal Obamacare, they have to have a concrete plan to replace it. Many on their own side are saying they simply can't take away health insurance from millions of Americans. But here's the problem. There are many conflicting ideas, no clear consensus on the best way forward. And that, some believe, is because of the success of Obamacare.
There is a widespread assumption now that the federal government is responsible for providing most, if not all, Americans with access to some form of affordable health insurance. And that didn't exist in 2009 before the Affordable Care Act.
Barack Obama says if any Republican plan improves on what's available, he'll give it his full support. And he knows that no matter what comes next, it'll be shaped by what he did, what he created, and that he leaves his own imprint on the future of healthcare in America. Alan Fisher, Al Jazeera, Washington.